who ever told me this kind of experience. And that is the exact...
Did you disbelieve it as a medical doctor?
I wondered if it was caused by the various medications that we had given her, or perhaps caused by a lack of oxygen.
Now, how do you know
it
wasn't?
I went ahead and I did my own study of that exact topic. I have interviewed well over 100 children who have a lack of oxygen to the brain, who are treated with all kinds of medicines, who also are mechanically ventilated and in scary intensive care units, but were not near death. None of them had this experience.
You're trained medically, right? You know that tissues die, cells die. How do you buy all this? How do you explain it to yourself with your own training?
It's very difficult to explain from a medical standpoint. Remember, when patients lapse into coma, that should wipe clean the slate of consciousness.
Correct.
Comatose patients should not be dreaming, should not be having hallucinations. In Crystal Merzlock's case, her pupils were fixed and dilated, meaning, you know, that what I was always trained was that there was no brain activity. And yet she could accurately describe everything I was doing to her. She said, "I saw you put a tube in my nose. I saw you take me into another room where you put me into a machine that looked like a donut," which was her description of a CAT scanner. It's clear that at the point of dying, some other neurological abilities or capabilities or something take a person.
You're not, listen, this body is something that you use as a modality, as a way to move in the physical environment. I sit and watched them work on my body. Everybody, this is standard out-of-the-body experiences.
So therefore, you know you go on to something else after this,
you
out
know
of this body.
This system that was created for you to function in this environment, but this is not you. You're in here because when you go and you are freed from your body, and mine was such an enormous, the pain and the freedom and the expansiveness of the other side, then you know automatically you're separate from it. So it's a whole other science.
How can how can you see their own body when you no longer have a functioning brain to process visual images? You no longer have a functioning retina. Many times these patients' eyes are taped closed.
It's got to be something else, right? Gotta be, doctor.
You see to nearby Cedars-Sinai Medical Center.
And the paramedics put me on code red and blue right to Cedars-Sinai, where Dr. Lauren Hooten did brain surgery for an hour, 2 hours. He told me if I was 3 minutes late, I wouldn't be here. Wouldn't be alive.
Suffered a very severe traumatic brain injury, as well as some bony fractures as well. He had a fracture of the back, of the low back, and of the pelvis. But the most devastating injury was the brain injury.
And it was a real hard time, you know, and from then on it started the process of, well, your dad's not going to make it more than 72 hours, and if he does, he'll be a vegetable.
Probably 50% of people who have this kind of injury do die. Only 20% do well, and probably only 10% return to work the way he has.
Gary still has no memory of the 6 weeks he spent in the hospital. But he does remember crossing over to another reality.
You know, on the other side, there's no distance, time, or space. I could have been there for 3 days, 3,000 years, or 3 seconds. It's all the same.
Right after being released from the hospital, Busey insisted his views hadn't changed about helmet laws. But a year after facing death, Busey sang a different tune.
I have a 17-year-old son who's an expert motocross dirt bike rider. And he's made me very aware of helmets. From ages 16 to 21 or 25, they should be mandatory.
Busey suffered no brain damage from his head injuries, but he's still Hollywood's go-to guy for wild men and offbeat characters.
Yeah! But the point in life is it's so precious, it's so short on Earth, and it's so sweet. Good talking to you.